Most fungal infections stay on the surface. They itch, they peel, they go away. This one doesn't. Doctors thought it was cancer. Some thought it was tuberculosis. Others believed it was a harmless cyst. But what they were actually seeing was a rare fungal infection slowly building mass inside the body. It's called Histoplasma duboisii, also known as the African granuloma fungus, and unlike most fungal diseases, this infection doesn't rush. It hides. Histoplasma duboisii is found mainly in parts of Africa, and it behaves very differently from the more common Histoplasma species. Instead of causing fast lung symptoms, this fungus creates slow-growing granulomas, hard, tumor-like masses that develop under the skin, inside bones, and sometimes deep within organs. That's what makes this infection so dangerous, because it doesn't look like an infection. People first notice a lump, a swelling in the face, a firm mass under the skin that doesn't hurt. Doctors order scans. X-rays show bone destruction. Biopsies reveal dense tissue that looks malignant. And that's where the mistake happens. This fungus mimics cancer so well that patients are sometimes sent down the wrong treatment path for months or years before the real cause is discovered. Histoplasma duboisii usually enters the body through the lungs or through broken skin, but once inside, it doesn't trigger an aggressive immune response. Instead, it settles quietly, allowing the body to wall it off into granulomas. Those granulomas keep growing, slowly, silently, without pain. In some cases, the infection spreads from the skin into the bones, causing swelling, deformity, and fractures that seem to appear without trauma. In others, it affects lymph nodes or internal organs, becoming a chronic fungal disease that lingers for years. This is why it's often misdiagnosed. Doctors aren't looking for a deep fungal infection when a patient presents with tumor-like masses. They're looking for cancer, or tuberculosis, or bacterial abscesses. Meanwhile, the fungus keeps expanding. What makes Histoplasma duboisii especially difficult to diagnose is how rare it is outside of endemic regions. Many clinicians have never seen a case in their careers. Lab tests aren't always conclusive. Imaging alone can't distinguish it from malignancy. And because the infection grows slowly, patients often delay seeking care until the disease is advanced. By the time the correct diagnosis is made, the infection may have already spread. Treatment exists, but timing is everything. Antifungal medications can stop Histoplasma duboisii, but only when doctors recognize it early. Advanced cases require long treatment courses, and in severe situations, surgical removal of infected tissue. This isn't a surface-level skin fungus. This is a fungal infection in humans that behaves like a silent infiltrator. It doesn't burn, it doesn't itch, it builds. And that's the real danger. Histoplasma duboisii proves something unsettling about infectious diseases. The most dangerous ones aren't always the fastest. They're the ones that disguise themselves as something else entirely. Cancer, tumors, benign growths, all while being none of those things. This infection also highlights a larger problem in medicine: misdiagnosed infections. When a disease is rare, slow, and unfamiliar, it slips through diagnostic cracks. And when it does, patients pay the price. This isn't medical horror, this is real life. A real fungal disease that hides in plain sight. A real infection that builds mass instead of symptoms. A real reminder that not everything growing inside the body is cancer. Sometimes it's worse, because you don't fight it until it's already taken hold. And by then, the fungus has done exactly what it was designed to do: survive quietly. Like and subscribe for updates on daily episodes.